Good afternoon. My name is Bogale Worku. I am a professor of pediatrics and child health. I've been practicing newborn health for the last 25 years, and I have been a faculty at Sava University, Department of Pediatrics and Child Health. I was teaching both undergraduate and postgraduate students on newborn health, and I have been very much convinced that newborn health in this country is totally forgotten, and that the NICUs in the country of 100 million is only 5 or 6. So I decided to have my sabbatical leave, where I joined the Ethiopian Pediatric Society to engage and devote my full time on helping the Federal Ministry of Health in establishing NICUs in the country. Then, like 10 years back, we started with 7 NICUs in the country, where it went up to 230 NICUs by now. So I really am very happy that I decided to join the Ethiopian Pediatric Society to spearhead the establishment of NICUs in the country. You know, when I was in the Faculty of Medicine, Department of Pediatrics and Child Health, I was told and also convinced that newborn health was very expensive and luxury, because this is what we were told by our colleagues coming from abroad. When we had observership and bilateral collaborations with institutions in developed countries, they were very reluctant to take colleagues working on newborn health to be attached and work as an observership in their NICUs, because they thought when an individual comes back to Ethiopia, then he will be frustrated, because the establishment of NICUs require a lot of resources and special manpower. But thanks to the Lancet group, when they really said a huge number of mortality could be reduced by simple, low-cost, very high-impact interventions like identification of sepsis and treating sepsis with antibiotics, and also identifying babies who are not breathing and helping them breathe through Helping Babies Breathe program, and also helping them stabilize their thermoregulation using the skin-to-skin contact and kangaroo mother care. So that really has convinced many of us, including myself, where I really went deeply into these interventions through task shifting of activities of neonatologists and pediatricians to nurses. And currently, all the NICUs that I mentioned are by and large taken care of or run by nurses who received 4 weeks training and have shown a lot of miracles by reducing mortalities in their respective facilities. So, in general, the journey of newborn health in Ethiopia is just a decade. So before 1 decade, as I mentioned, we had only 5 to 6 NICUs in the country, and it's giving limited services to limited number of newborn babies, because we were thinking that to run NICUs, you need very expensive equipments like ventilators and so on. But for the last 1 decade, when we were convinced, especially when I was convinced that it's possible to run a newborn program with a low-cost technologies, and then that is when I really went into very wide activities of training nurses and midwives, actually, and also giving orientations for doctors and health officers that they need to support nurses who got the training, short-term training on common neonatal problems, and support them, help them in establishing NICUs in their facilities, and also help them when they have problem. But I learned that the nurses who got this training were not only knowledgeable and skillful, but also their attitude has been changed, because they are convinced too that newborns can be saved with simple interventions, with skin-to-skin contact, with bag and mask ventilation, with kangaroo mother care, and with simple antibiotics like gentamicin and ampicillin when they suspect infection. So they are really very much convinced and devoted to these activities. One thing that has convinced me a lot is the history that, or the testimonies that they give us when they go back to their facilities, when they have seen a lot of changes in surviving newborn babies in their facilities. Then they all fight for a better and quality care through demanding for simple things, demanding for continuous presence of water in their unit for hand washing, demanding for spaces where they can keep mothers that can do KMC, and demanding for continuous monitoring of babies 24 hours a day, 7 days a week coverage, which was not a usual condition before. So they were usually challenged that what has been done to you? Why are you so fighting for babies? And that shows that they are really convinced that they could save life, and change can be made only through them. If they are not there, then baby will die. So really I'm happy for that. The challenge that we have actually is in a continuous gap filling in having trained personnel. Thanks to the Federal Ministry of Health, they have started now a degree program on neonatology, and the graduates of this degree program in neonatology started taking over of NICUs and trying to improve quality of care than even before. And also the government has invested a lot in helping babies survive, purchasing life-saving equipments that are really important, like CPAP, radiant warmers, food therapy machines. And now the other challenge with this is having them sustainably functioning through maintaining and having supplies for consumables used with CPAP machine and other machine equipment. But in general terms, the trend in helping babies survive in this country is not bad, I would say. If not, like we wish to reduce the mortality to 12 per thousand. It's going slow, but it keeps on going. So I will keep on hammering, and hopefully we'll reach the target for SDG. Thank you very much, and thank you for watching.